Owen Smith launched the constitutional challenge to allow cannabis extracts for medical patients that was recently ruled upon by the Supreme Court of Canada. He's definitely a hero in the community if you guys don't know him already. As a very hardworking employee of the Victoria Cannabis Buyers Club for 5 years, Owen gained personal experience with patients on the cutting edge of the nascent medical cannabis industry. Owen is now a writer for the Cannabis Digest quarterly journal, liftcannabis.ca, as well as cameo.ca, covering topics across the vast spectrum of cannabis interest. He is co-host of the People Advocating Cannabis Education-based talk radio show on the internet radio channel Time for Hemp. Please help me to welcome Owen Smith. I also just want to mention that Owen has worked so hard in creating these questions for us, a vast multitude, and this is an amazing gift that he's given us with his knowledge and expertise. So it's going to be a wonderful first panel. And I'd like to just welcome the first panelist up onto the stage. So you guys all know Philippe and Lucas, and I'll go ahead and welcome Dori Dempster as well. So Dori has been the executive director of the Medicinal Cannabis Dispensary since its opening in 2008. She's a cannabis patient and advocate, almost wife to 10 for 9 years, and the proud mother of 3 grown sons. Dori started working in the cannabis industry in 2005 as a mail clerk, sending seeds around the world from the Vancouver Seed Bank. And then she opened the doors 3 years later with Dana Larson to the Medicinal Cannabis Dispensary. Dori and Dana have since opened a second store and with an awesome staff now serve over 6,500 members from the 2 locations, including a mail order service serving all of Canada. The first store is at 880 East Hastings in the Strathcona neighborhood, serving the downtown east side. And the second store is at 1182 Thurlow, near Davie Street, in an old heritage-style house with a beautiful garden full of flowers serving the West End. Welcome, Dori. Our third panel presenter is Zach Walsh. Zach is a PhD in art psych and an associate professor of psychology at University of British Columbia. He's also the director of therapeutic, recreational, and problematic substance use lab and a registered clinical psychologist. Zach has published more than 40 articles and book chapters on topics related to substance use, personality, and mental health. And his work has been supported by grants and awards from the Canadian Institute of Health Research, Health Canada, BC Interior Health, the American Psychological Association, and others. He's the principal investigator for several externally funded research projects, including the largest survey to date of Canadian medical cannabis patients, and a recently initiated clinical trial of cannabis for the treatment of post-traumatic stress disorder, PTSD. He has presented research on the therapeutic use of cannabis to diverse audiences, including the government of Uruguay's Department of Health, the Canadian House of Commons, and the International Cannabinoid Research Society. We're very honored to have Zach as well joining us. Wonderful panel guest is MacPherson, and Deirdre is currently serving as the executive director at one of Canada's oldest medical cannabis dispensaries, the Victoria Cannabis Buyers Club. After his 10-year career as a consultant in the cultivation of cannabis, Mr. MacPherson headed the successful transition of WCBC to an incorporated non-for-profit in 2012, while developing a standardized business model, including a comprehensive quality control system, best practices guidelines, and governance structure. He continues to help move dispensaries to a mature and legitimate market through his work with the Canadian Association of Medical Cannabis Dispensaries, while co-founding the cannabis technology company Cameo in 2014. And I'd also like to take this time to honor and thank Cameo as one of our major sponsors. I'll actually share a little bit about Cameo as well. So, yeah, we're very grateful for the sponsorship of Cameo. And Cameo has been established as an internet technology and research company based in Vancouver. It was founded by Dieter, Jess Ligner, and Bruce Giovando as well. Cameo, at its heart, is a technology company created around a vision of an open and progressive cannabis industry. Cameo aims to partner with producers and laboratories to bring new depth and analysis to customer experiences. By bringing together patient experiences, producer knowledge, and laboratory-tested strain profiles, Cameo can create an invaluable resource for all stakeholders. Thank you so much, Cameo. Thank you, dear. Certainly not least, Ms. Jamie Shaw joining us on Skype. Woo! So Jamie is the spokesperson for the BC Compassion Club Society, president of the Canadian Association of Medical Cannabis Dispensaries, and vice chair of the Vancouver chapter of Women Grow, a networking platform to raise the profile of women in the cannabis field. Jamie Shaw's experience in the theater and film industry has seen her take up residence in New York, Toronto, LA, and Vegas before settling in Vancouver in 2004. In 2005, she began a 2-year term as director of the BC Compassion Club, who are one of our wonderful exhibitors today. She currently serves the BCCS as a media coordinator and has been their delegate to CAMCD since 2012. She's a big fan of general filing as well. I'll let you explain that one, Jamie.
Beta graphene.
Okay, thank you. Thank you. Welcome, Jamie. Do you want to share a little bit about where you are right now? Jamie. My mic is on.
It's muted. There we go.
Can you hear me? We're going to just sign language. Hi, Jamie, can you hear us? Oh.
It's coming.
Did that help sound?
Okay, that's what I'm
Thank you. Sounding. All right. Well, it is my great honor to be here and to be asking questions to people who are my mentors, people who I've learned from over the last 10 years, people who've been doing this job for decades. And it's because of these people, not necessarily because of anything that the government has done willfully, that we are in the situation that we are in today, that we have the options that we do, and I'm hoping that I can challenge them a little bit with a few questions. And none of our panelists know what these questions are, so there is an authenticity to this. And so as you listen, you may have questions of your own, and hold on to them for our question period at the end of each panel. You also have the opportunity to meet with our panelists during the breaks and ask them any other questions then. And I really encourage you to attempt to get as much out of them as you can, because they're brilliant. So cannabis can be viewed through many lenses, from many perspectives, and today we're going to look at 3. The first one is the medicinal, then we're going to go into historical, and finally we're going to address the government regulations and public activism. So, let's start off by asking our panelists to share one impactful experience that you've had in your work with medical cannabis patients. You each have 2 minutes. Who would like to go first?
I guess I can start. I think recently the most impactful thing I've seen is the shift in demographic. When I first got involved in the medical cannabis field with the Victorian Cannabis Buyers Club, I had assumptions, like many other people, about the clientele, their age, and possibly what they were looking for from medical cannabis. Over the last 2 years, there's been a distinct shift from those that are looking for symptomatic relief, so things like anxiety, stress, pain, to actual therapeutic use. So those are the people that are 55 years and older. They've worked their entire lives, and they're reaching that point where it's catching up with them. So these are just the side effects of growing old. And whether it be cancer or ulcerative colitis, serious things like multiple sclerosis, we have a lot more people that are looking for alternatives to pharmaceuticals, specifically opiates. Many of those opiates, I think many people in this room know, actually are a death sentence in and of themselves if taken long enough. So it's been this massive sea change in those that are looking for it and how they're looking to use it. So these are people that walk through the front door of the dispensary, they're 60, 70, 80, and 90 years old. They've heard through the internet or family. It's really neat to see grandchildren coming in with their grandparents, and the grandchildren are the ones that have been pestering them for the last 2 years to try this out. And they come in, there's a lot of trepidation, and what they're really looking for is education and some help making informed decisions about often end-of-life care. So they're looking for something to increase their quality of life for whatever little time they've been given. And I think that's really important, the palliative care that can be associated with cannabis, especially when you talk to the people that work in hospice and palliative care. They're looking for solutions too. So I think that's been the biggest impact recently.
Thank you, Dieter. And I just restate the question that I'm looking to get one story of one individual, if possible, who has been impacted by medical cannabis through your experience. And 2 minutes. Zach.
Hi. Yeah. Well, I'm sort of, my mind is racing trying to think of one story. So I'll just use my own story. As someone who's used cannabis for a number of years without perhaps conceptualizing it as therapeutic use, engaging in research with people who use cannabis therapeutically, being really moved by the generosity and commitment of the group. So often when you're conducting research, you'll find that you have to really encourage people to come forward with their stories or to engage in the research, and there's a skepticism. But the openness of medical cannabis users, when we started doing research, and the interest and enthusiasm really moved me. So I think in general, as a group to work with, it's phenomenal. And to start to reflect on my own use and my own use of other medications as well, and being able to substitute some of those medications for cannabis when it comes to quality of life issues, pain, mood. So I think coming to understand my own use in a therapeutic context has been one of the most exciting aspects of my journey as a medical cannabis researcher and as a patient.
Thank you, Zach. Dori.
I think back to the day that I met Carolyn. Carolyn phoned me and told me that she had cancer, breast cancer, and both of her breasts had been removed recently. She was having a lot of difficulty with the radiation and chemotherapy, and it was terrifying her to her very core to go show up for treatment. And her very brave son, who knew that she had been a teacher all her life, he approached her with a bag of cannabis and asked her to please try. And against everything that she knew, she decided that she would honor her son and at least let him know that she had tried one thing that he had asked her to. She tried the medicine, and it relieved her nausea and it made her feel better. And she was calling me because her bag was empty now. And she didn't want to put her son back in that dangerous position of having to go and find a bag for her out on the street somewhere. And I agreed with her, and I asked her to please come down and that I would help her. And that lady and I have known each other for many years now, and I have a special hat that she brought to me that she used to wear to cover her bald head when she was recovering. And when she was ready to retire her hat rather than burn it, she brought it to me as a symbol. And I cherish that hat that she wears. Carolyn's biggest struggle was understanding about the job that she had done all those years in teaching children that cannabis was bad. And she felt very guilty for that. And so with Carolyn, we decided that we would just help her to understand that she did what she knew at the time, and now she could do better. And so she kept taking her medicine, and she came to visit us, and she got healthy, and she got well, and now she understands that we need to educate our children in a better way. And that's what I do every day when I come to work, is trying to make it a better, safer place for people together.
When I think of the people that have inspired me over the last 20 years of working with medical cannabis, I tend to go to the oldest patients that I've helped a lot of the time through end-of-life processes, and also to the youngest patients that more recently have come on to discover medical cannabis, some therapeutic benefits of CBD in helping childhood seizures and childhood seizure disorder. One woman, however, really comes to mind. I remember meeting Judith. She'd just been diagnosed with cancer when when I was introduced to her. She had just started to find that medical cannabis was useful in dealing with the symptoms of her chemotherapy. And she was a really amazing woman. The first thing she did when she got diagnosed with this very severe cancer is she went out and bought the biggest freaking black truck you could ever imagine. And so she was a small woman, and she climbed into this huge black truck, which I think gave her a feeling of indestructibility. It made her feel safer, it made her feel stronger, and in light of what she was facing, I think that's what she needed. Ultimately, the medical cannabis wasn't able to stop the progress of her cancer, but as when we're treating people through end-of-life symptoms and also through youth, I find that the most amazing thing about medical cannabis is not just the impact that it has on patients, but the impact that it has on those who love them. When we're talking about end-of-life, if it allows people to use fewer opiates in the end-of-life, to suffer less, and to still have that emotional contact with their loved ones, I can't think about how many times families have thanked me or the people that I've been working with to provide medical cannabis because they feel those last few weeks, those last few months were richer because their loved ones weren't so impacted by the use of opiates. And I also think about those parents now that contact us to talk about kids who used to suffer, in some cases, 20, 30, 100 seizures a day, who are now virtually or almost seizure-free through the use of CBD. Ultimately, it's really been such an honor and privilege to help people through those end-of-life symptoms and to help people and be part of people's healing. And that's really what keeps me working in this field and has kept me working in this field for the last 20 years. It's being able to participate in people's healing now.
Jamie?
Is this a... You guys hear?
We have a bit of a loose connection. You keep talking?
Absolutely. I will keep talking. Oh, that was...
You're on.
Don't wiggle.
Maybe volume down a little?
Okay.
Oh,
You go, Jamie.
sorry. I could actually pick one experience. We see them every day. For me personally, I think I had a very old dog who passed away last year, and if he hadn't been on cannabis tincture for the whole year before, I don't think he would have been able to walk. I'm having the impression that I'm not really coming through very clearly.
No, you are.
Oh, perfect. Yeah, he actually got so bad that he couldn't stand up. Once I helped him up, he could stand. And I don't know why it took me longer to get to the cannabis tincture. And once I tried it, he had a whole other year of pretty decent movement. And I had a whole other year with my dog, so he had a whole other 7 years from cannabis tincture. And we see that humans aren't the only ones that can benefit, and some of the touching stories are from some of the animal members that we serve.
Okay, well, those are all very impactful, touching stories about how cannabis can be used as medicine. But for any of us who watch the television, or maybe just television stuff that's posted on the internet, we recently heard from our health minister that marijuana is not a medicine. And she will never tell Canadians that marijuana is a medicine. So, as people who have obviously provided it in this context, why is she wrong?
She's stubborn.
I think where she's coming from it's cop out. So what she's saying is the drug approval process, drug identification number, and clinical trials, $1 billion+ is the only way that we can call something medicine. I think it's a semantic argument about what is medicine and how we define that. I think it's also a cop-out because it means that the government doesn't have to provide the same access, the same funding, the same research, the same support to this as they would anything else we classify as medicine. We run into this when it comes to taxation and the way they word a health document instead of a prescription. They're really looking for their cake and they want to eat it too. So I think it's just a cop-out. It's this government saying they've been forced by the courts to do this. They're not saying that they support it, and it's just a way to avoid having to do any meaningful work around this, whether through policy, research, or even supporting the cost of it. Patients shouldn't have to pay this. We have a national healthcare service for a reason. Yeah.
Any further comments?
I think that ultimately she's playing with language. What is the definition of a medicine? And to say that one person is capable of defining what is and isn't a medicine. The real question is it an effective medicine? And when we make those kind of estimations of whether something's an effective medicine, we want to look at the cost and the benefit ratio. And when we look at the minimal harms that are associated with cannabis compared to a lot of other medicines that are being widely used, and when we talk about the benefits that are clearly attested to by so many Canadians and people across the world, the question should be how effective of a medicine is it, and how can it best be used, rather than engaging in some kind of semantics of whether it is or isn't medicine according to some criteria that she's not laying down.
Thank you. Okay, so if I choose not to take your word for it, I might go online to PubMed and type in cannabis for medicinal purposes, and then see that there's thousands of studies that have been done. But yet there's still not the randomized double-blind clinical trials that Health Canada require to admit that cannabis is a medicine. Why is that?
Well, I think one of the big challenges has been a lack of research grade supply in the US. The only supply that's allowed for research, and it's very rarely allowed, that may be starting to change in the next couple of years, but has been the NIDA supply. It's a very limited amount of, in terms of the types of cannabis that they'll allow to be grown. At the University of Mississippi, they're just starting right now to produce high CBD cannabis to be able to be used in research. For research purposes. They've never allowed high THC cannabis to be used for research purposes at NIDA, and so that's been one of the main obstacles to getting the kind of clinical trials done that we need done. In Canada, we've had a similar issue with a lack of research grade supply. We have had a supply by the monopoly producer for the last 12 years that was available for research, and the clinical trials that have been done, amazingly enough, using both the NIDA supply, very low grade, low THC cannabis, and the federal supply that was produced by Project Plant System, once again a very low THC, low grade cannabis, have produced amazing results. And the research that has been done using that cannabis has shown amazing therapeutic impacts despite the limits to that supply. I think that the other reason that we haven't seen the kind of clinical trials that we would see in other medications right now comes to us from a pure business point of view. As a pharmaceutical company, pharmaceutical companies out there cannot patent this plant. They're not interested in working with herbal medicines per se, so their motivation to fund the kind of research that needs to be done around whole plant cannabis medicine and whole plant cannabis extracts hasn't been there. That being said, if you do research and you widen your search, your Google search to include cannabinoids, not just cannabis, you'll find that every major pharmaceutical company out there in the world right now is looking at cannabinoids and the endocannabinoid system, the interactions of cannabinoids and the endocannabinoid system, and they're doing so in a lot of cases with synthetic single agent cannabinoids that they can patent and have some control over. So I think that one of the benefits that we've seen actually in the implementation of the MMPR and in the evolution of medical marijuana access in the US through the US state programs has been now that you have companies that are heavily motivated to fund whole plant cannabis research. And that's the kind of research that we're doing right now with Tilray and in partnership with UBC, Dr. Zach Walsh on post-traumatic stress disorder. It's a phase 2 clinical trial of 40 participants. It's going to be the biggest medical cannabis clinical trial that's happened in Canada in the last 30 years. And I'm so excited to see Tilray and other licensed producers getting into and funding clinical research. I know that Canada is funding an osteoarthritis study, and then we have a licensed application, a licensee, a licensed applicant that's funding some of MJ's research on HIV/AIDS. So hopefully over the next 5 years, particularly in areas like pediatric epilepsy, we're going to see the kind of clinical research that's considered the gold standard among scientific research and policymakers start to fill the void that's been there for far too long.
Thank you. And so, I'm learning about cannabis, and I look on the news, and every medical cannabis story has a picture of somebody smoking a big joint. And now I'm wondering if I'm going to be put into that category. There's a certain amount of stigma around recreational cannabis use, which medical users may not be willing to wade into. What can we do to abate the stigma, or can we draw a line between medical and recreational cannabis use? It's a tough question.
She wants to talk.
I can maybe speak to the stigma a little bit. In a study that we just wrapped up of people who are suffering with arthritis, we recruited broadly arthritis patients, and so we were able to ask them why they did or didn't use cannabis in comparison to a lot of studies that have only looked at cannabis users. And the 3 top reasons why people weren't using cannabis, first of all, they were concerned about harm to their lungs, and despite the Tashkin study and some other studies showing that cannabis certainly doesn't have the same profile as tobacco, and that there's not evidence of at least with cancer, of any kind of lung damage, people still have that stigma of can't smoke anything, and may not be aware that there's other options in terms of vaporization and edibles. So I think when that becomes more mainstream and people recognize that there's other ways to ingest cannabis, that might go a long way. The other thing that they were worried about is that they would be stigmatized by their doctors, and we certainly hope that that is going to fade with more education. The third reason they gave is that they were concerned about being drowsy. So one that is perhaps based in reality, and other than that, stigma and lack of information seems to be holding people back as well.
Yeah, I think that Jamie wants to.
You would, Jamie?
Sure, yeah. All of those questions kind of relate to they're very related to each other. One of the reasons why Rona, I think, will never accept this as a medicine is because she equates medicine as a pharmaceutical. I think that is something that society's been going through for a very long time, since the 30s. There's been an active push to equate medicine with a pill. And I think that that is something that we're starting to learn now is not necessarily the best type of medicine. We are talking about all of the studies and the research being done on cannabis. It's so difficult because they are still isolating certain cannabinoids and then claiming the different results from the different cannabinoids as though it actually is not effective for different things, instead of, as was mentioned earlier, actually doing research on strains and genetics and their effects. And again, it's this whole idea of not accepting plant medicine, which ties into the stigma. The stigma around cannabis also has been going on since about the 30s, and it's been multi-layered. It's been stigma around different racial groups using it. It's been stigma around the idea that any kind of smoke at all would have any sort of benefit, which of course is basically colonizing Native American culture, the whole idea that we've equated anything that smokes to the type of smoke that comes out of cigarettes after we've sprayed.
It's going to sink into society. We have to keep in mind, of course, that when polled, 80 to 90% of Canadians support the use of medical cannabis. That's across party lines and across all provinces. So it's quite remarkable the support that we have, and yet we have politicians who still treat this as a hot potato issue, which is quite remarkable. But I do think we are turning a corner around the stigma, certainly around the medical use and likely around the recreational use as well. I found it quite amazing that at the last mayoral contest in Toronto, all the mayoral candidates were asked whether or not they'd used cannabis, and all of them admitted to having used cannabis, except for one. And they admitted it readily. They almost wore their use of cannabis as a badge of honor to suggest that yes, they'd had these experiences in the past and therefore could understand these issues. What I found amazing is the one gentleman who suggested that he had never used cannabis apologized for it. He said he was very busy in the 60s and 70s, and he didn't know what happened, but he never had a real chance to try it. And I think that just shows that this is no longer a death knell to your political career when you admit to using cannabis. And we now see, of course, that we've got Justin Trudeau, one of the leaders of the Liberal Party, admitting not only to past cannabis use, but to cannabis use while he's an MP. We've got Tom Mulcair and Elizabeth May, who have not only admitted use, but are trying to push their parties and policies, I think, that are different than the current federal party's policies on this. And I think it's quite amazing and telling that even some members of the Conservative Party and of the Republicans in the U.S. are now not only admitting use, but are openly supporting regulation of cannabis for recreational purposes. So we are seeing that this is starting to change. It's going to take hopefully not another generation to do so, but over the next few years, I think you're going to see that people will be more quick to admit their use, and that use that they've had wasn't necessarily not only a bad thing, but maybe had some positive impacts on their lives.
I have a quick one just about the question itself, about how we can solve this stigma. And the biggest thing is the idea that this is illegal and it's under prohibition. So when something is illegal, the substance is illegal, it's illegal because there's a perceived harm to the people consuming it. Laws are generally not intended to protect the self from the self. That's a healthcare issue. So I think opiate misuse, and that's illegal, makes sense because there is a considerable amount of documented harm, but the prohibition of the substance itself, so the idea that a medical user needs an exemption from a law that applies to everybody else brings with it stigma by definition, because it's us versus them. There's no reason to think that we couldn't create a medical exemption from the state of legality where the plant doesn't carry any criminal charges with it. So until we get rid of that criminal aspect to production, distribution, sale, and consumption, there will always be stigma associated with it, whether or not we educate or move forward.
Good answers. I'm feeling more confident now. I think I might talk to my doctor. But my doctor, he's not taking it in. He's not listening, and now what do I do? My doctor won't sign me up for the new licensed producers, the MMPR. How am I going to get past this? There seems to be a stigmatization in the medical community as well, and can I navigate this medical community to get myself authorizations are no longer breaking the law?
I think it's a huge problem is the patients, it's very confusing right now. There isn't a single system. There's multiple tiers. We have the MMAR, we have the LPs, and we have dispensaries, and then you have the gray and black markets that are there. I think doctors as gatekeepers was a mistake. Doctors are unwilling to prescribe because they're not being supported. Also, doctors almost never prescribe something like cannabis, where it isn't a single fixed pharmacokinetic property. They're giving them access to everything. I used to say that it's like prescribing somebody the ability to grow poppies and figuring out whether they're going to make muffins or heroin. Heroin doesn't quite equate, but you get the idea. What I advise people is you're always welcome to go to your doctor and educate them and try and offer them advice, but be aware that a doctor can fire you just like you can fire them. With this multi-tiered system, with patients being the ones that need real information, I think it's incredibly difficult. You can't force a doctor to prescribe. You just can't. And that's a question of whether or not a patient's choice of what type of medicine they use trumps access. Once again, that comes down to the issue of legality. Until we can sort out the legality of cannabis, then there's all these other philosophical issues about who can use, how can use, who should be the gatekeepers, who shouldn't, and where does patient autonomy and choice come into it. And I don't have the answer to that. That's a tough one.
I've seen research recently that about 50% of Canadians say that they'll prescribe cannabis, or at least would consider so under some circumstances, and 50% absolutely won't. But the amazing bit of that research was that that 50% that won't, 80% of those would say that they refer the patient to a doctor that did have a higher level of comfort with medical cannabis. So I do think that we're definitely making progress. This is something that's going to take a lot of time. I definitely recommend if patients are going in to see their doctors and they're not aware of their doctor's current position on this, that you can arm yourself with a little bit of research. There's a lot of it online for almost any condition that you might be suffering from. There's likely to be a publication or something that you can bring with them. And ostensibly, doctors consider themselves evidence-based scientists, and if you can present them with research, certainly you can open up that dialogue and discussion with them. I also think that it's important for us to understand that doctors just don't get an education right now in the endocannabinoid system and the use of cannabis. So there are CME programs that Tilray and other licensed producers have sponsored that are specifically given to physicians. We've done presentations specifically here to physicians with 30 or 40 people in the room, where doctors are teaching other doctors about the endocannabinoid system. And it's amazing how effective that can be, because ultimately doctors like to hear other doctors and other doctors' opinions in terms of driving the change that we need to see. I think that another thing that's going to make a big difference, to be honest, is, and I think that we can all understand this to some extent, is as suggested, doctors are not really comfortable working with an herbal substance, and so the use of oils, tinctures, and extracts that have been available through dispensaries for since the start of dispensaries, and that are now going to be available through licensed producers, will make a big difference in terms of the perception, anyway, of doctors of control and of understanding about how to prescribe medical cannabis for their patients. The facts are that when it comes to smoked or vaporized ingestion, you actually get much more bioavailability than you do through oils or extracts. So there's actually a lot of predictability in the use of smoked or vaporized cannabis that you may not have by orally ingesting products. But I think that when a doctor sees a gel cap and knows that it's got 10 milligrams of cannabis in it, or THC in it, they understand it. That's language that they understand, and that will likely go a long way to bringing more doctors on board and supporting the medical use of cannabis.
Fair enough. So my time asking questions is coming to an end, but your time is just beginning. If you would like to ask our panel a question, please approach the microphone in the aisle.
Hutch.
Mr. Hutchinson.
Are we on? Are we on?
No.
Mike's not on.
Mike's on, the light's on, but to speak, be here. Yeah. Can you hear me? Okay, I'd like to ask a question. I'm probably looking at think I'm looking at the two gentlemen on either end here. I'd like to ask about, we're in an interesting situation as far as I'm concerned. I'm really happy with the results of your trial, but I want to know what the comfort level is between the LPs and the dispensaries. Are the LPs happy with dispensaries existing? In my world, we'd be happy if we could have LPs opening dispensaries, but that doesn't exist at the moment. But are LPs willing to support the existence of dispensaries in their current model, or do they see that as a threat? I mean, I'm aware of the implication it's had recently on your staffing levels, Philippe, so I want to know what the reality of it is. And also, what is the comfort level with the dispensaries data that the LPs are there and they're being provided this shield of Health Canada's system?
I go first now. When it comes to the licensed producers, it's an amazing opportunity. The dispensaries have been operating in Canada for the better part of 20 years and face obstacles everywhere they go because we are breaking the law. We are selling cannabis without license illegally to those that are in need. Licensed producers have an amazing opportunity to bring together funding, research, politicians, and move this forward. They find themselves in a regulatory box, which makes it incredibly difficult for them to affect change at the speed and rapidity that the dispensary can. By breaking the law, opening ourselves to criminal charges, and then challenging the law, much like Owen did, we can affect change in a very real way through the court system. I think that licensed producers will do amazing work and are doing amazing work with education when it comes to doctors and others. I think there's a great deal of tension though because they've had to invest a serious amount of money in these facilities, and their partner in this industry, Health Canada, treats them like criminals. So Health Canada's number one concern when it works with licensed producers is whether or not they're diverting. They're not really concerned about patient care, and that's telling as to the difficult situation these licensed producers find themselves in. They all jumped in because Health Canada said the water's warm, we're going to revolutionize this industry. Oh, and by the way, it's going to be worth $1.3 billion by the year 2020. I think that's correct. I think there's money. It is an industry. I think that's separate from the idea of freeing the plant. They're two different things, and hopefully they're not mutually exclusive. I myself work with as many licensed producers on a personal level as I can because I think a unified industry is important. This is not about my right to sell or their right to sell. This is about the plant and the people that use it, and it doesn't matter how we get there. Hopefully we can all just work together. Recently, there's been tension. We've come to heads. Both groups are lobbying in their own ways to make sure that our idea is right, your idea is right. No, let's hope we can all be calmer and level-headed on this, because if we start fighting the dispensaries and licensed producers, the people that are going to lose are the patients. Full stop.
I think that there's so many different Canadian patients out there right now, and there's some patients that would consider using medical cannabis, but only when it ends up in a pharmacy. There are some patients who would only consider using Sesament, that they'll never use a raw cannabis product. They like to see a pharmaceutical. And there's some patients that will only access cannabis through a federally regulated licensed system. And there's other patients, as we all know, who access it through the black market, who access it through dispensaries or otherwise. I think that right now licensed producers are really so tied up in trying to meet the Health Canada regulations. It's a really shifting landscape for us, not just in terms of the regulatory landscape, but literally last week, Health Canada, in response largely to the Owen Smith trial, has allowed us to finally expand our potential products to include extracts and other alternatives that have been so popular with patients, and that I think, as we all know, are going to be popular with doctors as well. To be very honest, Tilray is really focused right now on trying to open up those channels, on trying to work with Health Canada to make sure that what we're able to do and what we're able to produce meets the needs of our patients, of those patients who do want to use licensed producers. And that's really where our energies and our direction are spent right now. So there's no active lobbying for or against anything at all, except for opening up access for patients through the licensed producers right now, and who want to access that system.
Everybody else can say something, please.
comment or one for your business? Because I know that Greg Engel has come out publicly against dispensaries. So I just want to clarify that there is some lobbying happening, so it's not as quick as that.
No, I think that Greg has pointed out that that because of the large proliferation of dispensaries over the last few years, there's been a significant impact on the potential growth of the LP market, and there's no doubt about that at all. I think that when Tilray Privateer looked to get into this business, there was a few, well, less than a few dozen, probably a dozen dispensaries in Vancouver, and just 5 or 6 in Victoria, and a scattering of other dispensaries in the rest of Canada. And right now, of course, we're seeing a massive expansion of those numbers, and it is, without a doubt, having an impact on the people who are accessing cannabis through the MMPR program. I think that I think that that's what Greg was referring to, certainly in those comments.
Thank you. Thank you, David. A few more questions.
Hi, I'm dispensary owner to dispensary owner Dori. I wanted to build upon the wonderful question asked earlier. What do you do? Pretend I'm a patient and I'm coming to you. My doctor, I'm an American citizen, my primary physician who has since left practice, will not prescribe to me. What do? I want this wonderful medicine that I've heard about. What do you tell these people, Dori?
I always tell people to work with the doctor that is in charge of their health. Not to go drug seeking out in the community, trying to find a doctor specifically for cannabis, because when you're looking for your health care, you should be looking for your whole health care, and cannabis would just be a part of that. So I always suggest to people that they go to where they're getting their health care and keep going back. Don't take a no for the first answer. I had to talk to my doctor about 9 times before he finally agreed that I could become a member of the BC Compassion Club. But he was terrified. He didn't want to be a pot doctor. He wanted me to get well, but he was worried about his own position. Turned out later, he shared with me that he had been one of the first doctors that had actually helped patients get onto the original program that was 33 pages long. And he had worked tirelessly to help this patient get his medicine because he wouldn't take it unless it was perfectly legal for him. Once they made it legal for him, he didn't like it. So now my doctor was reluctant to sign for me because what if I didn't like it and he's going to go to all this trouble again. The BC Compassion Club was a lot simpler program than getting onto Health Canada at the time. But he was very reluctant, and I know that it was because I just kept going back to him with what my real concerns were. And they were the stress that was being caused to my body by having to go and find somebody that would have a bed for me in the next town, and about what to do with my children while I was going to get that medicine, or if there was extra stress that would come to us because having to find a babysitter, or whether to leave the kids in the car while you go in to get your bag. And once my doctor was able to determine that these were real issues that I was facing, it's not just that I was just trying to get an easy score, he understood that this was causing stress and it was causing an undue amount of anxiety on me. And so he reluctantly signed my papers. And I find this with a lot of people. If they just keep going back to their doctor and they just keep having their doctor understand how it's impacting their lives. And instead of just seeking the signature all the time and then getting mad when the doctor says, I don't know enough about it. And they pitch a fit and leave the office, and then you try to find a new doctor, and now you're drug seeking. And that's not good behavior. So I always find it's just better for people to just work within the community that you're working within, keep going to your doctor, keep getting your test results, get copies for yourself because you're entitled to them. And then in a dispensary like ours, you can use a bunch of diagnoses to come together and get your membership if the one doctor is reluctant. But it's just a matter of just keep going back and just understanding that this is about your health and not to get too stressed out trying to get a signature. One thing we have to remember is constitutionally we're allowed to use this as a medicine. We're allowed to choose this. So we don't necessarily have to have a card in our pocket that says it is legal.
Thank you.
Thank you.
My name is Andrew Muir. I've got a two-part question. One for Dieter and Dori. Dieter, you say you've seen a move to 60-plus people using medical marijuana. What forms are you seeing? Are you seeing moving away from smoking more to edibles and extracts?
About 90% oral, 95% oral consumption. They're not looking to smoke. No matter how you cut it, smoking is always going to be the less healthy of the forms. Relative harms aside, smoking is smoking. They're all looking for oil. So oral, it's generally pills and capsules filled with oils, suppositories, surprisingly enough, or something that is quite popular. Topical for arthritis and stuff like that. Yeah, that's where the growth has been. They're not looking to smoke. One of the major things is that when you consume oral, you get between 4 and in some cases 24 hours of symptom management. And they're generally looking for non-psychoactive forms, so either a 1-to-1 ratio of THC to CBD or higher in CBD. And that seems to be the commonality between them all. They have grown up their entire lives consuming oral medicines in pill form, so that is their own personal comfort zone. And that's what they're looking for. They're looking for a steady and consistent dose. They're looking for education and support, and they're looking for something that generally isn't going to quote-unquote ruin their golf game, which we actually hear all the time.
Could help improve it some days.
Yeah, or improve it, yeah.
Dori, so with the new ban on edibles in Vancouver, how is your dispensary going to deal with providing that to the market?
Well, if we want to get a license, we're going to have to go along with the licensing scheme, the bylaws as they're set out. But we plan on helping our patients learn how to use this sealed vegetable oil container at home in a safe way. And we'll just be working towards helping Vancouver Coastal Health come to a better decision and get our edibles back into our dispensaries because they're needed.
Thank you very much.
I think we only have time for one more question, but
I
I
have
will.
just a statement, a short one.
But I'll encourage anybody else to talk to these people during the break, and we'll have one short statement from Jody.
All right. I'd like to make a short statement before my question to Dori. My short statement is that smoked medicine has advantages that orally adjusted medicine doesn't. And if everybody's still fearful of cannabis smoke, it's because activists aren't doing their jobs in addressing those concerns. Dori, mail order. Are you shutting down or are you fighting that particular regulation?
It is my understanding from reading the bylaws that only storefronts are not allowed to be using delivery or mail order services. And we don't deliver or do mail order out of our storefronts.
That is the law.
So you're saying there's a loophole?
You can do it elsewhere. Off the counter.
Oh, okay. Thank you for stating the obvious that I needed to hear.
Keep it very brief because the whole discussion between dispensaries versus LPs, Philippe has done incredible groundwork in the early days of serving people through a dispensary, fighting in court. So when you think of LPs and dispensaries, they're all different. They're like restaurants, they're like coffee shops, they're like clothing shops. So I'm not an LP person, but don't group them together. Every LP has different motivations, different people in charge, and different acceptance of medical marijuana and different goals, but so do dispensaries. There's even a dispensary in town that just said, we hope to get people to stop using marijuana because they shouldn't depend on anything. So remember, stop grouping people and start realizing that people need different choices, and as long as the choices and options are protected, then more and more people benefit. So bravo to the hard work and the sacrifice and the risk involved that everybody's given to make dispensaries and LPs and hopefully more possibilities possible. So thank you.
Wow, what a wonderful discussion and engagement. Great speakers, great questions. So that brings us to the end of the first panel. I know there's so many other questions, but hopefully we'll be able to interact and engage during the break.